The emergency room doors exploded open with a force that made every head turn. What stepped through wasn't just a man, it was a mountain of muscle and rage, towering 7 feet above the white-tiled floor. His eyes burned with a fury that made seasoned doctors step back, his massive fists clenched like hammers ready to strike. The entire ER fell silent except for the steady beep of monitors and the heavy breathing of this giant who seemed ready to tear the place apart. But, standing between this human hurricane and potential chaos was someone nobody expected to make a move. A rookie nurse, barely 5 months on the job, who weighed less than half what this giant did. What happened next would become legendary in hospital corridors across the country, a story that would be whispered about for years, shared in nursing schools, and prove that sometimes the biggest surprises come in the smallest packages. This is the true story of how one quiet Tuesday night changed everything, and why you should never underestimate the power of quick thinking, perfect timing, and a nurse who refused to let fear win. Sarah Matthews had always been small. At 5 feet 2 inches and barely 110 pounds, she looked more like she should be teaching kindergarten than working the night shift in one of Chicago's busiest emergency rooms. Her fellow nurses often joked that she could hide behind the four-pole, and the orderlies had taken to calling her pocket nurse, though always with affection. But what Sarah lacked in size, she made up for in determination. Fresh out of nursing school with only 5 months of real-world experience under her belt, she approached every shift with the kind of focused intensity that made her supervising nurse, Linda Chen, shake her head in amazement. "Girl, you need to learn to breathe," Linda would say, watching Sarah triple-check medication dosages and reorganize supply cabinets that were already perfectly organized. "This job will eat you alive if you don't pace yourself." Sarah would just smile and keep working. She had good reason to be so careful. She was the first person in her family to graduate from college, having worked 3 jobs to pay for nursing school while caring for her diabetic mother. Every day in the ER felt like a gift, even the difficult ones. Tuesday night started like any other. The autumn rain drummed against the windows of St. Mary's Hospital, creating a steady rhythm that somehow made the fluorescent light seem less harsh. Sarah was restocking the trauma bay when she heard Dr. Rodriguez talking to the security guard about the full moon. "Always brings out the crazies," Dr. Rodriguez said, adjusting his stethoscope. "Mark my words, Thompson, we're going to have one of those nights." Thompson, a retired police officer who had been working hospital security for 6 years, chuckled. "Doc, every night brings out the crazies. That's why they pay us the big bucks." Sarah listened while organizing gauze pads by size. She had learned that the veteran staff liked to predict what kind of night they would have based on weather, moon phases, and what they called the vibe. She found it amusing but had noticed some patterns herself. Friday and Saturday nights meant alcohol-related emergencies. Rainy days brought more car accidents. And full moons? Well, the jury was still out on that one. The ER was unusually quiet for a Tuesday. They had treated a teenager with a broken wrist from skateboarding, an elderly man with chest pains that turned out to be severe indigestion, and a woman who had accidentally superglued her fingers together while doing crafts with her grandchildren. Standard stuff that gave everyone time to catch up on paperwork and maybe grab a coffee. Linda was training 2 other new nurses, Marcus and Jennifer, who had started just a week ago. Sarah remembered feeling exactly like them, excited, nervous, and absolutely certain she would make some horrible mistake that would hurt someone. Linda had been patient with her then, just as she was being patient with them now. "The key," Linda was explaining, "is to stay calm no matter what comes through those doors. Patients can sense your energy. If you're panicked, they'll panic. If you're confident and calm, it helps them feel safe." Sarah nodded along, remembering those exact words from her first week. She had written them down in the small notebook she kept in her scrub pocket, along with dozens of other pieces of wisdom Linda had shared. Dr. Rodriguez appeared at the nurse's station with a coffee that looked strong enough to dissolve paint. "Chen, what's the word on bed availability?" "Trauma 1 and 2 are open," Linda replied, checking her computer screen. "Bed 7 has the chest pain, Mr. Patterson, waiting for his daughter to pick him up. Everything else is clear." "Good. Maybe we'll actually get to sit down tonight." Sarah smiled at that. In 5 months, she had learned that saying anything about a quiet night was almost guaranteed to jinx it. She had seen Dr. Rodriguez make that exact comment before, only to have an ambulance arrive 5 minutes later with multiple trauma victims from a car accident. The automatic doors at the ambulance entrance whooshed open, and Sarah automatically looked up from her supply cart. 2 paramedics wheeled in an elderly woman who was conscious and talking. Standard transport, probably a slip and fall. Room 3, Linda called out, grabbing a clipboard. The smooth routine of triage began: vital signs, medical history, insurance information. Sarah continued her work, finding comfort in the predictable rhythm of an ordinary night. Around 10:30, the coffee shop across the street closed, and Sarah could see the owner, Mrs. Patterson, locking up and hurrying to her car through the rain. The sight made her think about her own mother, who would be asleep by now after taking her evening insulin. Sarah made a mental note to call her in the morning before her shift started. The radio at the nurse's station crackled to life. "St. Mary's, this is Unit 14. We've got a 42-year-old male, conscious and alert, minor lacerations to the hands and face. Probable alcohol involvement. ETA 10 minutes. Linda picked up the radio. "Copy that, Unit 14. Trauma 2 is ready." Dr. Rodriguez looked up from his chart. "Probable alcohol involvement? Great. Just what we needed to complete the evening." Sarah had handled plenty of intoxicated patients in her short time at the hospital. Some were belligerent, others were weepy, and a few were surprisingly philosophical. The key, she had learned, was to stay professional and not take anything personally. People said and did things when they were drunk that they would never do sober. The minutes ticked by quietly. Marcus was practicing starting IVs on a training arm while Jennifer reviewed medication protocols. Linda was catching up on continuing education credits on her computer. Dr. Rodriguez had disappeared into the break room with his coffee and a medical journal. Sarah finished restocking the trauma bay and moved on to organizing the medication cart. She loved this part of the job, making sure everything was exactly where it needed to be, ready for whatever emergency might come through the doors. Every vial in its proper place, every piece of equipment cleaned and functional. The ambulance arrived exactly on time, its red and blue lights painting the walls through the rain-streaked windows. Sarah watched through the glass doors as the paramedics unloaded their patient. She could see it was indeed a man, sitting upright on the stretcher, apparently cooperative. "Looks like an easy one," Linda said, walking toward Trauma 2 with a fresh gown and gloves. Sarah nodded and continued her work, organizing medication by expiration date. She had no way of knowing that in exactly 47 minutes, her entire world would change. That the quiet Tuesday night she was enjoying would explode into chaos. That her size and experience would become completely irrelevant in the face of something she had never trained for, never imagined, never seen in any textbook or simulation. The man on the stretcher was talking calmly to the paramedics as they wheeled him inside. He was large, Sarah noticed, but seemed docile enough. His hands were bandaged, and there were small cuts on his face that looked like they came from broken glass. Probably a bar fight or an accident at home. Dr. Rodriguez emerged from the break room and walked toward Trauma 2, nodding to the paramedics. "What do we have?" Marcus Riley, 42, found him outside Murphy's bar with lacerations to both hands and superficial cuts to the face. Says he fell through a glass door. Blood alcohol approximately 0.15. Vitals stable, no loss of consciousness. The patient, Marcus Riley, was answering Dr. Rodriguez's questions in a calm, measured voice. Sarah couldn't hear exactly what he was saying, but he seemed cooperative and alert. The kind of patient who would be cleaned up, bandaged, and discharged in an hour or two. Linda was taking his vital signs while Jennifer observed, practicing the routine they had discussed during training. Everything was proceeding normally, just another minor emergency on a quiet Tuesday night. Sarah finished with the medication cart and glanced at the clock. 11:15. In about 6 hours, her shift would end, and she would drive home through the early morning light to her small apartment, where she would heat up leftover soup and catch up on the medical journals she tried to read between shifts. she had no idea that before this night was over, she would become a legend. The change began so subtly that no one noticed at first. Marcus Riley, who had been calmly answering Dr. Rodriguez's questions just minutes before, started shifting restlessly on the examination table. His voice, which had been clear and cooperative, began to slur slightly. "Mr. Riley, I'm just going to clean these cuts on your hands," Linda said, approaching with antiseptic and fresh gauze. "This might sting a little." Marcus looked at her with eyes that seemed suddenly unfocused. "Don't touch me," he mumbled, pulling his hands away. Linda paused, the antiseptic-soaked gauze in her hand. In her 15 years of emergency nursing, she had developed an instinct for when a situation was about to shift. Something in Marcus's tone, the way his body language had changed, set off quiet alarm bells in her mind. "Mr. Riley, I need to clean these wounds to prevent infection," she said calmly, maintaining her professional tone. "It will only take a few minutes. I said don't touch me." His voice was louder now, and Sarah looked up from where she was organizing supplies near the nurse's station. Through the open door of Trauma 2, she could see Marcus trying to stand up from the examination table. Dr. Rodriguez appeared instantly. "Mr. Riley, please remain seated. We're almost finished here." But Marcus was already on his feet, swaying slightly. Standing upright, his true size became apparent. He was not just tall, he was massive. At least 7 feet tall with broad shoulders and arms that looked like they could crush a basketball. A hospital gown stretched tight across his chest, and his bandaged hands hung at his sides like clubs. "Where am I?" he asked, his voice taking on a confused, aggressive edge. "What did you people do to me?" Linda exchanged a quick glance with Dr. Rodriguez. This was not unusual behavior for someone with alcohol poisoning, but the patient's size made it more complicated. "Mr. Riley, you're at St. Mary's Hospital. You had an accident, and we're treating your injuries." "Hospital?" Marcus looked around the room as if seeing it for the first time. His eyes were bloodshot and wild, darting from face to face. "I don't remember. I don't remember coming here." Sarah watched from the hallway as the situation developed. She could see Jennifer and Marcus, the two newer nurses, backing away slightly, their training warring with their instincts. This was exactly the kind of scenario they had practiced in nursing school, but seeing it in real life was different. "Mr. Riley," Dr. Rodriguez said, stepping closer, "you've had quite a bit to drink tonight. It's normal to feel confused. Why don't you sit back down and let us finish taking care of those cuts?" "Confused?" Marcus's voice rose dangerously. "I'm not confused. I know what you people are doing." The paranoia was setting in now, a common side effect of severe alcohol intoxication combined with whatever other substances might be in his system. Sarah had read about this in her textbooks, but reading about a 7-foot man experiencing drug-induced paranoia was very different from watching it happen. Linda quietly reached for the phone at the nurse's station. Hospital security was just a button away, but calling them would likely escalate the situation. Thompson was a good security guard, but he was also 62 years old and nowhere near Marcus's size. "Mr. Riley," Linda tried again, "no one is doing anything to you. We're here to help. You came in with cuts on your hands, remember? From the glass door?" Marcus looked down at his bandaged hands as if seeing them for the first time. For a moment, confusion replaced the anger in his eyes. Then, without warning, he ripped the bandages off, revealing deep gashes that immediately began bleeding again. "You did this," he roared, blood dripping onto the white floor. "You cut me." Dr. Rodriguez stepped back, his hand moving toward the emergency button on the wall. "Nurse Chen, please call security." But Marcus heard him. In his altered state, the word security apparently triggered something primal. His face twisted with rage, and, suddenly, he was no longer a confused patient. He was a 7-foot mountain of muscle and fury, convinced that everyone in the room was his enemy. "Security," he bellowed. "You want to lock me up?" He lunged toward Dr. Rodriguez, who barely managed to dodge out of the way. Marcus's bandaged fist smashed into the medical equipment cart, sending instruments flying across the room. The crash of metal on tile echoed through the emergency department. Code Gray, Trauma 2, Linda spoke quickly into the phone. Code Gray, Trauma 2. Code Gray meant security emergency with a violent patient. Sarah had heard it called twice in her 5 months at the hospital, but never for someone like this. The other incidents had involved normal-sized people who were quickly restrained. This was different. Marcus spun around, looking for threats everywhere. His movements were clumsy but incredibly powerful. When he backed into the four-pole, it bent like a pretzel. When his elbow caught the edge of a cabinet, the metal dented. Jennifer and the newer nurse Marcus had pressed themselves against the far wall, their eyes wide with fear. Dr. Rodriguez was trying to circle around to the door, but his patient, was blocking the exit. "Everyone stay calm," Linda called out, though her own voice was tight with tension. "Mr. Riley, we want to help you. Please don't hurt yourself." "Help me?" Marcus laughed, a sound that had no humor in it. "You people are trying to poison me. I can feel it in my blood." He was describing the sensation of whatever drugs were in his system, but, in his paranoid state, he interpreted it as an attack. Sarah watched as he examined his bleeding hands, his face contorting with rage. "You cut me and, then, you poisoned me," he said, his voice dropping to a dangerous whisper. "But I'm not going down easy." Thompson arrived first, slightly out of breath from running down the hall. He took one look at the scene and immediately radioed for backup. At 6'2" and 5'8", he was completely outmatched. "Sir, I'm going to need you to calm down," Thompson said, his hand resting on his radio but not his weapon. Hospital security was trained to de-escalate, not to fight. Marcus turned toward the new voice, and his eyes locked onto Thompson's uniform. "Police," he snarled. "I knew it. You're all working together." He took a step toward Thompson, who wisely retreated into the hallway. Sarah realized that the situation was spiraling completely out of control. Marcus was now between the medical staff and the exit, bleeding from his hands, and convinced that everyone was trying to hurt him. "Where's the real backup?" Thompson spoke quickly into his radio. "We need Chicago PD here now." But Chicago police were at least 10 minutes away, probably more in the rain. Marcus was here now, growing more agitated by the second, and his size advantage was overwhelming. Dr. Rodriguez tried a different approach. "Mr. Riley, I'm Dr. Rodriguez. What's your first name? Don't try to trick me." Marcus roared. "I know what you're doing." He grabbed the examination table and hurled it toward the door. The heavy metal table crashed into the doorframe, partially blocking the exit. Dr. Rodriguez barely managed to duck as it flew past his head. Linda was still on the phone with hospital administration, trying to coordinate a response. But what could they do? The standard protocol for violent patients assumed they could be physically restrained. No one had a protocol for a 7-foot giant who could throw furniture like it was made of cardboard. Sarah watched all of this unfold from the hallway, her mind racing. In nursing school, they had learned about de-escalation techniques, about staying calm under pressure, about protecting yourself and your patients. But none of her training had prepared her for this. Marcus was bleeding more heavily now, the wounds on his hands reopened and dripping steadily onto the floor. In his paranoid state, he didn't seem to notice or care. If anything, the sight of his own blood was making him more agitated. "You made me bleed," he shouted at no one in particular. "You're trying to drain me." The delusion was complete now. In his mind, the hospital staff were not trying to help him, they were torturing him. Every attempt at medical care was seen as an attack. Every word of comfort was perceived as a threat. Sarah realized that conventional approaches were not going to work. Thompson was calling for police backup. Linda was trying to coordinate with hospital administration. Dr. Rodriguez was focused on keeping everyone safe until help arrived. But help was still minutes away, and Marcus Riley was growing more dangerous by the second. His massive frame filled the doorway of Trauma 2, blocking any easy escape. His bloodied hands were clenched into fists the size of bowling balls. and his eyes held the wild look of someone who had completely lost touch with reality. Something had to be done, and it had to be done now. Sarah looked around at the controlled chaos of the emergency department, at her colleagues trying to manage an impossible situation, at the massive man who needed help but couldn't accept it. And then, an idea began to form in her mind. It was crazy, dangerous, and completely against everything she had been taught. But, as she watched Marcus Riley tear apart Trauma Room 2, she realized that sometimes crazy ideas were the only ones that worked. Sarah's idea was born from an unusual combination of her small size, her attention to detail, and something she had learned in her previous life before nursing school. Before she had decided to dedicate herself to healthcare, Sarah had worked as a veterinary assistant for 3 years to help pay for her education. Working with large, frightened, and sometimes aggressive animals had taught her something that wasn't covered in any nursing textbook. Sometimes the smallest person in the room had the biggest advantage, especially when dealing with someone whose judgment was impaired. She remembered a particularly difficult case involving a massive German shepherd who had been hit by a car. The dog was in pain, terrified, and snapping at anyone who tried to help. The veterinarian, Dr. Kim, had been unable to get close enough to sedate the animal. The dog was too large and too agitated for the usual restraint techniques. Sarah had volunteered to try a different approach. Instead of trying to overpower or corner the frightened animal, she had made herself as small and non-threatening as possible. She had approached slowly, speaking in soft tones, moving with deliberate calm. The dog's aggressive posture had gradually relaxed, and she had been able to get close enough to administer the sedative that saved its life. Sometimes, Dr. Kim had told her afterward, being small is an advantage. Large, frightened creatures see big people as threats. But someone small and calm? That's different. That's not threatening. Now, watching Marcus Riley destroy Trauma Room 2 while everyone else tried to figure out how to stop him, Sarah realized that the same principle might apply. Every person trying to help Marcus was either in a position of authority, doctor, security guard, or was approaching him as part of a group. In his paranoid state, this confirmed his belief that he was under attack. But what if someone approached him differently? Someone who couldn't possibly be seen as a physical threat? Someone small enough that his drug-addled brain might not immediately categorize as an enemy? It was a dangerous idea. Marcus Riley could kill her with one swing of his massive fists. But every second that passed, he was getting more agitated, bleeding more heavily, and destroying more equipment. The police were still minutes away, and there was no guarantee they would be able to handle the situation without someone getting seriously hurt. Sarah made her decision. She walked quietly to the medication cart and pulled out a pre-filled syringe of lorazepam, a powerful sedative that could calm Marcus down if she could somehow get it into his system. The problem was getting close enough to administer it without triggering his paranoia. Lyndon noticed her movements immediately. "Sarah, what are you doing?" "I have an idea," Sarah whispered back, slipping the syringe into her pocket. "But I need everyone to back away from the room. Give me some space." "Absolutely not," Linda said firmly. "You are not going in there alone. Linda, look at him." Sarah gestured toward Marcus, who was now throwing medical supplies around the room like confetti. "He sees everyone as a threat. But maybe he won't see me as one." Dr. Rodriguez overheard the conversation. "Nurse Matthews, that's completely out of the question. You could be killed." "Doctor, with respect, what we're doing now isn't working. He's going to hurt himself or someone else if we don't do something different." Thompson's voice crackled over the radio. "Chicago PD is still 8 minutes out. Requesting immediate backup from any available units." 8 minutes might as well have been 8 hours. In the trauma room, Marcus had found a metal tray and was banging it against the wall, leaving dents in the reinforced plaster. His bleeding hands were leaving red smears everywhere he touched. "You people think you can keep me here," he shouted. "But I know what this place really is. I know what you do to people like me." Sarah took a deep breath. "I'm going in." "No, you're not," Linda said, grabbing her arm. "Linda, I worked with large, aggressive animals for 3 years before nursing school. I know how to approach someone who's frightened and confused without triggering their defensive instincts. He's not an animal, Sarah. He's a 7-foot man who could break you in half. Which is exactly why he might not see me as a threat. Dr. Rodriguez was shaking his head vigorously. The liability alone, if something happens to you. Something is going to happen anyway, Sarah pointed out. Look at him. He's losing blood, he's becoming more agitated, and sooner or later he's going to try to leave that room. When he does, he's going to run into all of you standing out here, and someone is going to get seriously hurt. She was right, and everyone knew it. Marcus was clearly building up to something bigger. His movements were becoming more violent, his voice was getting louder, and the delusions were becoming more elaborate. If I can approach him the right way, Sarah continued, I might be able to calm him down enough to get close. I've got lorazepam. If I can inject it into a large muscle group, it will take effect quickly. And if he sees you as a threat too? Thompson asked. Then, I'm small enough and fast enough to get out of the way. It wasn't much of a plan, but it was better than waiting for the police and hoping Marcus didn't hurt himself or try to leave the room. Sarah could see the doubt in everyone's faces, but she could also see them running out of options. At least let me clear everyone else from the hallway first, Linda said finally. If this goes wrong, I don't want other patients or staff in the path of destruction. Sarah nodded. That was smart thinking. Linda quickly coordinated moving the few remaining patients to the far side of the emergency department and positioning the other staff members behind the nurses' station where they would be protected but could still respond if needed. Dr. Rodriguez pulled Sarah aside. If you're really going to do this, you need to be smart about it. Don't approach him directly. Don't make eye contact initially. Move slowly and keep your voice quiet. And, for God's sake, if he shows any sign of aggression toward you, get out of there immediately. Sarah checked her pocket to make sure the syringe was secure. Lorazepam was fast-acting when injected into muscle tissue, but she would need to get close enough to inject it into his shoulder, thigh, or buttocks, areas where the large muscle mass would absorb the medication quickly. How long for the lorazepam to take effect, she asked. In a man his size? 5 to 10 minutes for full sedation, but he should start calming down within 2 or 3 minutes. Sarah nodded and walked slowly toward Trauma Room 2. Marcus was still ranting, but his voice was becoming more slurred. Whatever substances were in his system were reaching peak effect, which meant his judgment and perception were at their most distorted. She paused at the doorway, watching him carefully. He was facing away from her, examining his bleeding hands and muttering about poison and conspiracies. The room was a disaster, medical equipment scattered everywhere, the examination table overturned, blood smeared on the walls. Sarah took a deep breath and stepped into the room. Mr. Riley, she said softly. Marcus spun around, his eyes wide and wild. For a moment, he just stared at her, this tiny figure in scrubs who had appeared in his destroyed domain. Sarah could see him trying to process her presence, his drug-addled brain working to categorize her as friend or foe. Who are you? He asked, his voice suspicious but not immediately hostile. My name is Sarah, she said, keeping her voice calm and quiet. I'm a nurse here. I wanted to check on you because you're bleeding. She gestured gently toward his hands, being careful not to make any sudden movements. Marcus looked down at his hands as if seeing the blood for the first time. They did this to me, he said, but his voice lacked the rage it had held moments before. They cut me. I know you're hurt, Sarah said, taking a small step closer. And I know you're scared. But I want to help you feel better. Marcus looked at her with confusion. She was so small, so non-threatening, that his paranoid mind seemed to be having trouble fitting her into his delusion of persecution. The other people, the doctor, the security guard, the other nurses, they were clearly part of the conspiracy in his mind. But what threat could this tiny woman possibly represent? You're not like them, he said slowly. No, I'm not, Sarah agreed, taking another careful step closer. I'm just here to help you. Can I look at your hands? They're bleeding pretty badly. Marcus held up his hands, examining them with the confused fascination of someone seeing them through a chemical haze. They hurt, he said, sounding almost childlike. I bet they do. Let me help you with that. Sarah was now close enough to smell the alcohol on his breath, close enough to see the dilated pupils that suggested he had taken more than just alcohol tonight. But, more importantly, she was close enough to inject the lorazepam if she could find the right moment. The key was to keep him calm and distracted while she positioned herself for the injection. She needed to get to his side or behind him, where she could access his shoulder or upper arm, the easiest targets for an intramuscular injection. Mr. Riley, why don't you sit down, she suggested gently. You look tired. Marcus looked around the destroyed room as if noticing the chaos for the first time. What happened here? You got confused, Sarah said simply. Sometimes that happens when people have been drinking. But, it's okay. We can clean it up. She was amazed at how quickly his demeanor had changed. With everyone else, he had been a raging giant convinced of persecution. With her, he was becoming almost docile, like a large, confused child who needed guidance. This was exactly what she had hoped for. Her size and non-threatening presence had allowed her to bypass his paranoid delusions. Now she just had to get close enough to administer the sedative that would bring this dangerous situation to an end. The next 60 seconds would determine whether Sarah's plan was brilliant or suicidal. Marcus Riley stood swaying slightly in the middle of the destroyed trauma room, his massive frame making him look like a confused giant in a dollhouse. Blood continued to drip from his reopened wounds, and his eyes held that glassy look of someone fighting through a chemical fog. Why don't we sit down and take care of those cuts? Sarah suggested, her voice remaining calm despite her racing heart. Marcus looked around the room again, seemingly puzzled by the destruction. Did I do this? You were scared, Sarah said simply. People do things when they're scared that they wouldn't normally do. But, you're safe now. She was carefully positioning herself to his left side, where she could access his upper arm if the opportunity presented itself. The lorazepam syringe felt heavy in her pocket, a secret weapon that could end this standoff if she could just find the right moment to use it. Marcus started to sit down on the overturned examination table, then seemed to realize it wasn't in the right position. He looked at Sarah with an expression that was almost apologetic. I think I broke it, he said. That's okay. We have other tables. Here, let me help you. Sarah moved to the intact chair in the corner of the room, the one piece of furniture that had somehow survived Marcus's rampage. It was a standard hospital chair, designed to support normal-sized people, and she wasn't sure it would hold his weight. But, it was better than having him stand. As she guided him toward the chair, she realized this might be her only chance. Marcus was focused on sitting down, distracted by the simple task of coordinating his movements. His left arm was positioned perfectly for an intramuscular injection. Sarah's hand moved to her pocket, fingers closing around the syringe. She had practiced IM injections hundreds of times in nursing school and during her clinical rotations. The technique was straightforward: identify the injection site, insert the needle at a 90-degree angle, aspirate to make sure you weren't in a blood vessel, then push the plunger to deliver the medication. But she had never done it on someone who could kill her if they realized what was happening. Let me help you get comfortable, Sarah said, moving behind Marcus as he struggled to fit his large frame into the hospital chair. This was it. His deltoid muscle was exposed and accessible. One quick stick, push the plunger, and, in a few minutes this nightmare would be over. Sarah pulled the syringe from her pocket, holding it low where Marcus couldn't see it. She was just reaching for his arm when Marcus suddenly turned his head to look at her. What's that? He asked, his eyes focusing on the syringe with the sharp clarity that sometimes cuts through even severe intoxication. Sarah's blood turned to ice. In his paranoid state, a syringe would be seen as exactly what he feared most: proof that the hospital staff was trying to poison him. She had 1 second to decide: abandon the plan and try to de-escalate, or follow through and hope she could inject him before he could react. She chose to follow through. This is going to help you feel better, she said, lunging forward to inject the medication into his deltoid muscle. But Marcus was faster than she anticipated. His massive hand shot out and grabbed her wrist, stopping the syringe inches from his arm. His grip was like a vice, and Sarah realized with horror that he could snap her arm without effort. "I knew it!" Marcus roared, his paranoia exploding back to full intensity. "You're trying to poison me too." From the hallway, Sarah could hear Linda shouting into her radio, "Code Gray escalated. Officer down. We need immediate assistance." But Sarah wasn't down yet. She was trapped, but she wasn't finished. Years of working with frightened animals had taught her that sometimes you only got one chance, and you had to make it count no matter what. Instead of trying to pull away from Marcus's grip, which would be impossible, she did something unexpected. She pushed toward him. Using his own grip as an anchor point, Sarah threw her full body weight into the injection, driving the needle through his shirt and into his deltoid muscle. Marcus was so surprised by her forward motion that for a split second, his grip loosened. It was enough. Sarah pushed the plunger, delivering the full dose of lorazepam directly into his muscle tissue. Marcus released her wrist and stumbled backward, looking at the empty syringe that was now sticking out of his arm. "You stabbed me," he shouted, pulling the syringe out and throwing it across the room. Sarah backed away quickly, putting the overturned examination table between herself and Marcus. Her wrist was already swelling where he had grabbed her, but she ignored the pain. The medication was in his system now. She just had to stay alive long enough for it to take effect. "You people are trying to kill me!" Marcus roared, his voice echoing off the walls. "You cut me, you poisoned me, you stabbed me." He started moving towards Sarah with murderous intent. Her small size, which had been an advantage moments before, was now a critical disadvantage. There was nowhere to run in the small room, and Marcus was between her and the door. But then, something interesting happened. Marcus took 2 steps toward her and, suddenly, stopped, looking confused. The lorazepam was beginning to take effect, but, at his size, it would still be several minutes before he was fully sedated. "I feel weird," he said, touching his forehead. Sarah stayed behind the examination table, watching carefully. Marcus was fighting the medication, trying to maintain his rage and paranoia, but the chemical was stronger than his will. "You drugged me," he said, but his voice lacked the fury it had held moments before. It was more of an observation than an accusation. "I gave you something to help you calm down," Sarah said honestly. "You were hurting yourself, and I was worried about you." Marcus sat down heavily in the chair, not because she had suggested it, but because his legs were becoming unreliable. The lorazepam was doing its job, slowing his reflexes and dampening his emotional responses. "My hands hurt," he said, looking at them as if he had forgotten about the cuts. "I know they do. Let me take care of them for you." Sarah emerged from behind the examination table, moving slowly. Marcus tracked her movement with his eyes, but the aggressive tension was draining out of his posture minute by minute. By the time Thompson appeared in the doorway with 2 Chicago police officers, Marcus Riley was sitting peacefully in the chair while Sarah cleaned and bandaged his wounds. The transformation was remarkable. The raging giant had become a cooperative patient who was fighting to stay awake. "Is everything under control in here?" one of the officers asked, clearly surprised by the scene. "Yes," Sarah replied, applying the final piece of medical tape to Marcus's left hand. "Mr. Riley is feeling much better now." Marcus looked up at her with eyes that were heavy but more focused than they had been all night. "You helped me," he said quietly. "That's my job," Sarah replied. Dr. Rodriguez entered the room with Linda close behind. Both of them looked at Sarah with expressions of amazement and concern. "Are you hurt?" Linda asked, noticing the swelling around Sarah's wrist. "Just a sprain, I think. Nothing serious." Dr. Rodriguez began examining Marcus, checking his vital signs and assessing his level of consciousness. "How much lorazepam did you give him?" 5 milligrams IM. Perfect dosage for his size. "He'll be sedated but stable for the next few hours." One of the police officers was taking notes. "So what exactly happened here?" Sarah looked around the destroyed trauma room, then, at Marcus, who was now struggling to keep his eyes open. Mr. Riley had a bad reaction to alcohol and, possibly other substances. He became confused and agitated. I was able to calm him down and administer sedation. It was a gross understatement of what had actually occurred, but it was accurate. The officer nodded and continued writing. Linda was examining Sarah's wrist with professional concern. This needs to be x-rayed. He could have fractured something. I'm fine, really. You're going to radiology, and that's not a request. Marcus was now fully sedated, sleeping peacefully in the chair that had somehow held his weight through everything. Dr. Rodriguez was starting in 4 to provide fluids and monitor his condition. Mr. Riley will be fine, he told the officers. Once the alcohol and whatever else he took clears his system, he'll be back to normal. We'll keep him overnight for observation. The immediate crisis was over, but Sarah realized that everyone was looking at her differently. Thompson was shaking his head in amazement. The police officers kept glancing at her with expressions of disbelief. Linda was treating her like she had just walked through fire. How did you know that would work? Dr. Rodriguez asked. Sarah thought about her answer carefully. I used to work with large animals. Sometimes the best way to help someone who's frightened and confused is to approach them without seeming like a threat. It was true, but it didn't capture the full reality of what she had just done. She had walked into a room with a 7-foot man in the grip of drug-induced paranoia, earned his trust, and then deliberately betrayed the trust to inject him with sedatives, all while risking her life with every movement. That was either the bravest thing I've ever seen, Thompson said, or the craziest. Maybe both, Sarah replied. As they wheeled Marcus to a secure room where he could sleep off the medication, Sarah realized that her quiet Tuesday night had become something completely different. Word of what had happened would spread through the hospital within hours. By morning, everyone would know the story of how the rookie nurse dropped the 7-foot giant. But, for now, she was just grateful that everyone was safe, including Marcus Riley, who would wake up in a few hours with no memory of the chaos he had caused and no idea that his life had been saved by a nurse who weighed less than half what he did. The story of what happened in Trauma Room 2 spread through St. Mary's Hospital like wildfire. By the time Sarah returned from radiology with her wrist in a support brace, thankfully, no fractures, just severe bruising, the entire night shift knew about the incident. Word had already reached the day shift supervisors, the hospital administration, and, somehow, despite everyone's attempts at discretion, several local news outlets. Dr. Rodriguez found Sarah at the nurse's station, where she was trying to catch up on the paperwork that had been abandoned during the crisis. Marcus Riley was sleeping peacefully in room 12 under police supervision, his condition stable and his blood alcohol level steadily decreasing. How are you feeling? Dr. Rodriguez asked, settling into the chair next to her. Tired, Sarah admitted. And a little shaky, now that it's over. That's normal. Adrenaline crash. You should probably go home early. Sarah shook her head. I'm fine. Besides, we're short-staffed, and I don't want to leave Linda with extra work. Dr. Rodriguez smiled. You know, in 15 years of emergency medicine, I've never seen anything like what you did tonight. It was just basic de-escalation, Sarah said, though they both knew it was much more than that. Basic de-escalation doesn't usually involve injecting sedatives into someone who could bench press a car. What you did was... He paused, searching for the right word. Extraordinary. Before Sarah could respond, Linda appeared with a cup of coffee and a serious expression. The hospital administrator wants to see you, Linda said. And so does the nursing supervisor. And the risk management department. And probably half a dozen other people before your shift ends. Sarah's heart sank. She had been so focused on helping Marcus and ending the crisis that she hadn't thought about the administrative aftermath. What she had done was completely outside normal protocols. She had put herself in danger, made medical decisions without direct physician oversight, and technically administered medication without a specific doctor's order. Am I in trouble? She asked. Linda and Dr. Rodriguez exchanged a look. Honestly? Linda said. We don't know. What you did saved lives, probably Marcus's life and, possibly others. But, you also broke about 15 hospital policies in the process. Dr. Rodriguez nodded. The good news is that I'm backing you 100%. My report will state that you acted appropriately under extraordinary circumstances and that your actions prevented a potentially tragic outcome. What about Marcus? How is he doing? Vitals are stable, blood alcohol is down to 0.12 and falling. He'll probably wake up around 6 a.m. with a massive headache and no memory of the past 4 hours. Physically, he'll be fine once we get his hands properly sutured. Sarah felt a wave of relief. Whatever consequences she faced, Marcus was going to be okay. That was what mattered most. The next hour was a blur of meetings with hospital administrators, each trying to understand exactly what had happened and what it meant for hospital policy. Sarah found herself telling the story over and over, each time focusing on different aspects depending on her audience. To the nursing supervisor, she emphasized her assessment of Marcus's mental state and her decision to use therapeutic communication techniques. To the risk management team, she detailed her consideration of alternatives and her judgment that immediate action was necessary to prevent greater harm. To the hospital administrator, she explained how her previous experience with agitated animals had informed her approach. Each group asked the same basic question: why had she decided to take such an enormous risk? Because someone had to, Sarah answered finally. Everyone else was focused on containing the situation or waiting for backup. But Marcus was getting worse by the minute. He was bleeding, he was destroying property, and sooner or later he was going to try to leave that room. When that happened, someone was going to get seriously hurt. The hospital administrator, a stern woman named Mrs. Patterson who had been running St. Mary's for 20 years, leaned back in her chair. Nurse Matthews, what you did tonight was either gross negligence or extraordinary heroism. I'm still trying to figure out which one. With respect, ma'am, I think it was just nursing. Mrs. Patterson raised an eyebrow. Explain. We're taught to advocate for our patients and to do whatever is necessary to prevent harm. Marcus Riley was my patient the moment he came through those doors. He was in crisis, and I did what I thought was best for him. By injecting him with sedatives without a physician's order? Dr. Rodriguez, who had been quiet throughout most of the meeting, spoke up. Actually, I want to clarify that. I had discussed sedation as a potential intervention earlier in the evening. While I didn't give a specific order for lorazepam, Nurse Matthews was acting within the scope of emergency nursing practice. It wasn't entirely true, the discussion about sedation had been purely theoretical, but Dr. Rodriguez was clearly determined to protect Sarah from administrative consequences. Mrs. Patterson made notes on her legal pad. We'll need to review this incident thoroughly and probably revise our protocols for dealing with violent patients. But, for now, Nurse Matthews, you're not in any disciplinary trouble. Sarah felt another wave of relief, but Mrs. Patterson wasn't finished. However, we need to discuss what happens next. Word of this incident is already spreading beyond the hospital. The local news stations have picked up the story, and they're calling you a hero. I'm not a hero, Sarah said quickly. I'm just a nurse who did her job. Try telling that to the reporters who want to interview you. Or to the nursing schools that want you to speak to their students about crisis management. Or to the medical journals that want to write about your innovative approach to patient care. Sarah felt overwhelmed. She had never wanted attention or recognition. She just wanted to help people and go home at the end of her shift knowing she had made a difference. Linda, who had been surprisingly quiet during the meeting, finally spoke up. Mrs. Patterson, Sarah has been through enough tonight. Maybe we could discuss the media attention tomorrow? Of course. But, Nurse Matthews, you should be prepared for some publicity. What you did tonight is the kind of story that captures people's imagination. The meeting ended around 4 a.m., leaving Sarah with 2 hours left on her shift. She returned to the nurses' station to find that the other staff members were treating her differently. There was a new respect in their voices, a sort of awe in how they looked at her. Jennifer, the new nurse who had started just a week ago, approached her hesitantly. "Sarah? Could I ask you something?" "Sure. How did you stay so calm? When I saw that man throwing furniture around, I was terrified. But you just walked right in there like it was nothing." Sarah thought about the question. It wasn't nothing. I was scared too. But sometimes being scared means you need to act, not freeze. Marcus Riley woke up at 6:15 a.m., just as Dr. Rodriguez had predicted. Sarah was there when he opened his eyes, checking his vital signs and monitoring his condition. "Where am I?" he asked, his voice hoarse but clear. "St. Mary's Hospital. You had an accident last night, and we've been taking care of you." Marcus looked at his bandaged hands, confusion evident on his face. "I don't remember much. Did something happen?" "You had too much to drink and got confused," Sarah said gently. "But you're okay now." He studied her face carefully. "You look familiar. Were you here last night?" "Yes. I helped take care of your injuries." "Thank you," he said simply. Sarah smiled. "You're welcome." Later, as she was preparing to leave at the end of her shift, Thompson found her in the break room. "I've been thinking about what happened tonight," he said. "In 30 years of law enforcement and 6 years of hospital security, I've never seen anything like it." "It worked out," Sarah said, gathering her things. "It worked out because you made it work out. You saved that man's life tonight, probably saved several lives. I hope you know that." As Sarah drove home through the early morning light, she thought about Thompson's words. Had she really saved Marcus's life? In his intoxicated and paranoid state, he might have seriously injured himself or others. He might have fought with police when they arrived, leading to a confrontation that could have ended tragically. Instead, he was sleeping peacefully in a hospital bed, his injuries properly treated, his condition stable. In a few hours, he would be discharged with referrals to substance abuse counseling and follow-up care for his injuries. The local news was already running the story when Sarah got home. The headline read, "Rookie Nurse Stops 7-Foot Hospital Rampage." The details were mostly accurate, though they made her sound more heroic than she felt. Her phone was already ringing with interview requests from nursing publications and medical journals. Her email inbox was full of messages from colleagues, friends, and strangers who had heard about the incident. But the message that meant the most came from her mother, who had seen the early morning news report. "I always knew you were special, honey. I'm so proud of you." Within a week, Sarah's story had been featured in Nursing Today magazine, the American Journal of Emergency Medicine, and a dozen healthcare blogs. She was invited to speak at nursing conferences across the country about crisis de-escalation and innovative patient care. The story took on a life of its own, growing in the telling until Sarah hardly recognized her own experience in some of the retellings. She became known as the nurse who dropped a 7-foot giant, though she always corrected people to explain that she had calmed him down, not knocked him out. Marcus Riley, for his part, made a full recovery. He entered an alcohol treatment program and sent Sarah a letter thanking her for her compassion and professionalism during his crisis. He had no memory of the chaos he had caused, but he understood that she had helped save his life. Dr. Rodriguez used the incident as a case study in his medical education lectures, focusing on the importance of creative thinking under pressure and the value of approaching each patient as an individual with unique needs. Linda was promoted to head nurse 6 months later, partly based on her management of the crisis and her support of innovative nursing practices. Thompson retired the following year, but not before telling anyone who would listen about the night he watched a rookie nurse walk into a room with a drug-crazed giant and walk out victorious. St. Mary's Hospital revised its protocols for dealing with violent patients, incorporating lessons learned from Sarah's approach. The new guidelines emphasized de-escalation techniques and creative problem-solving, though they also required additional safety measures that Sarah's situation had highlighted. For Sarah herself, life returned to normal remarkably quickly. The attention died down after a few months, and she was able to focus on what she loved most, caring for patients and continuing to learn and grow as a nurse. But the legend of that Tuesday night lived on. Years later, nursing students would still hear the story of Sarah Matthews, the rookie nurse who faced down a 7-foot giant with nothing but courage, compassion, and a syringe full of lorazepam. It became a story about thinking outside the box, about the power of empathy, and about how sometimes the smallest person in the room can make the biggest difference. And, sometimes, late at night in emergency departments across the country, when nurses faced seemingly impossible situations, someone would remember Sarah's story and find the courage to try something different, something creative, something that just might work against all odds. Because that's what nurses do. They find a way to help, no matter how big the challenge or how small they might seem in comparison. They find a way to make a difference, one patient at a time, even when that patient happens to be a 7-foot giant who needs someone to remind him that he's human.